Flu season is upon us. If you're thinking about getting that flu shot, you better hurry. Who knew there is a crisis with the flu shot? Not about how well it works, although that every year is up for question, but there is a lack of IV bags because apparently most of them were manufactured in Puerto Rico, and after the devastation from the hurricane, there's a shortage. Ashley Johnson has the full story. Ashley, what do you got for us?
Take a look at 21-year-old bodybuilder Kyler Bogman, who looks like the picture of perfect health. Sadly, Bogman died at a Pittsburgh hospital last week within days of coming down with the flu. The official cause of death was organ failure due to septic shock from the flu. Right now in central much of North Jersey, flu activity is classified as high by the U.S. Centers for Disease Control and Prevention.
Almost 40 to 50,000 people die every year in this country from the flu season. It's a fatal disease in some people, especially older, especially younger, but it is a problem.
The family of the healthy young man you just saw is urging people to immediately see a doctor if they aren't feeling well. Reports from Australia and their last flu season show that the vaccine has been shown to be less effective. I asked Dr. Charles Simone in Lawrenceville, New Jersey, should people get the flu shot? And he was straightforward in saying that he doesn't offer the flu shot at his office.
The flu vaccine has been shown by the Center for Disease Control and the National Institutes of Health. The flu vaccine for 2016-17 and 17-18 has been shown to be ineffective by those two federal organizations. But even if it were effective in a small percentage of people, it's only effective for a few months.
Many people are still heading to clinics at CVS and other pharmacies to get their flu shot, while the CDC has not determined the effectiveness of this season's flu shot. Another major concern during flu season is the shortage of IV bags. According to the U.S. Centers for Disease Control and Prevention, Hurricane Maria, which made a direct hit on Puerto Rico in September, disrupted a major supplier of IV bags.
The IV bags was for hydration purposes, right? So what you need to do if you have a flu syndrome or anything else, you should always stay hydrated. How do you know you're hydrated? The urine is colorless when you're hydrated.
The flu is trending over social media. USA Today tweeted, health officials across the USA are reporting misery, rising hospitalizations, and some deaths. The CDC tweeted, #flu. Severity indicators in latest flu report are similar to what was seen at the peak of the 2014-15 season. In Lawrenceville, I'm Ashley Johnson, reporting for Chasing News.
Thank you, Ashley. All right, let's bring in our A-plus panel to break this down. I'm joined by Democratic strategist Bill Caruso. Good to see you again. Thanks for being here. Attorney Misty Maris is here. Thanks for being here, Misty.
Thank you.
And Naima Ricks, who is a former school board member. Always good to see you, Naima.
Thank you.
All right, I'm going to start with you.
Okay.
First of all, who thought that all of the IV bags, for the most part, were being made in Puerto Rico? I talk about the unintended consequences of, them not being ready for this storm.
Right.
Do you get a flu shot?
Never, and I will never get a flu shot. But I
Really?
think never. Everyone who gets one gets sick. So why would I do that? But I think what we need to realize is that we need more support in Puerto Rico so that we can have the right supplies to help out our people here.
So, Misty, the politicos are out there. It was Trump's fault that it didn't recover quickly. So is this flu season Donald Trump's fault?
I don't think this flu season is Donald
Okay.
Trump's fault. What I think is maybe we need to look at diversifying where these products are made to make sure that if something happens anywhere, a natural disaster, not Trump's fault, despite what people may say, that there is a recourse, that you do have other sources.
Do you get a flu shot?
You know, I got a flu shot once, Bill, and I got the flu. So I don't get a flu shot
It's
anymore.
happened to me as well. Bill, what about you?
Well, in regard to a flu shot, no, I don't. And I'm in the same boat with these ladies and yourself, Bill. Not going to do it, and I did get sick when I got one. But in regard to this situation, I think a lot of people looked at the tragedy that happened in Puerto Rico. We had friends and family over there. I think some people said, okay, we're going to cross this off the vacation list. But I don't think people really understood what was going on.
Right.
I'm challenged by the fact, though, that here we are, we sit months later, and we still have this problem. And whether it's related to, and I do agree there should be some diversity here in terms of where we're getting these things from, but there's a federal government that's got to step in. We have a national emergency on our hands if this truly is a case with the shortages on these IV bags. Where's the federal government?
We need businesses to get in there, raise the price of these IV bags, and let's get some competition going. All right. Thanks, guys.